My main clinical and research focus is something called pulmonary rehabilitation, which is a treatment modality for patients with chronic respiratory disease that have symptoms despite optimal medical management. So what we do with these patients is we put them in different trials looking at different ways to exercise them, to give them better quality of life. And we've had recent influx of 2 new faculty members at the VA, and they have interests that sort of interdigitate with ours. We now have a Cardiopulmonary Exercise Lab, which is the only one in the Brown division. And that is a wonderful research-rich environment where we can do various studies at a depth that we couldn't do before. We also have another clinical researcher who is doing pulmonary hypertension research, and that dovetails very nicely with the Rhode Island Hospital people. So what excites me about the VA is that we're becoming much more integral to the overall research endeavors at Brown, and it's become, again, much more collaborative and much more enriching for me and for our department. So we have 4 faculty at the VA that all have interesting research projects that dovetail with each other. I think if you look at the theme of VA research, it's very patient-centered research. It's veteran-centered research because it's a VA, but it really is patient-centered outcomes. So we have a health outcomes research institute there where cardiology does projects and the other subspecialties, and pulmonary works along with cardiology on a lot of these projects, things like looking at how to prevent COPD patients from getting readmitted to the hospital, how to improve their quality of life, how to do self-management teaching skills to get these patients to self-manage. And I think that's really exciting and a little bit different from some of the other hospitals because we have a very closed system in terms of having these patients, these veterans, get all their health care from one healthcare facility. So it's a good fertile ground for that type of research. I mentioned earlier that we also have a Cardiopulmonary Exercise Lab, which means that we can not only look at our patients and why they may not be able to exercise and have activity levels that they want for their quality of life, but we can also aid the other subspecialties looking at patients who are thinking about surgery, patients who are looking at why their chemotherapy makes them so tired. So it's a really nice, rich environment in a patient population that is quite appreciative and quite willing to participate with research. So I think that's somewhat of a unique issue with the VA within the Brown system.